Hey everyone, Ryan here again with Advanced Physical and Aquatic Therapy. And today I'd like to talk about pain and current topics in pain neuroscience. I know that's a big word, fancy word, but really it just means how our brains perceive pain and how we think about pain can affect pain itself. So it's not always a good correlation to the physical problem or mechanical problem or tissue damage, but really there's a psychological and a neurological component to pain as well. So this is a pamphlet that we created for our patients that we try to go over with everyone that walks in our doors, and hopefully sharing it on a big platform like this will help more people. So it's called Explain My Pain, and it starts off with there's two types of pain, and I'm not coming up with this. This is people that have devoted their entire lives to researching pain and how the human experience of that affects people. And one type is called nociceptive pain, and the other type is centralized pain. Now, nociceptive pain is the pain that results in direct body tissue damage. It's like a strained muscle or a sprained ankle, things like that. Normally, this pain is acute and does not exist for more than 3 months. So, movement of the painful body region may be temporarily limited, and it avoids delaying the recovery. The other type of pain is centralized pain. So this is obviously more than 3 months. It's pain that originates at the spinal cord in the brain, and it's often a result of long-term nociceptive pain. It becomes memorized by your body's system. So it causes pain to linger despite the fact that that muscle, ligament, nerve has fully healed. This pain is usually persistent or chronic, and the movement of the painful region will not delay recovery and is encouraged, as it will help to desensitize the painful region, even though it may be uncomfortable. So that's our role in physical therapy often, is to just get people moving because it's best for them. And I would argue movement, even when the first 3 months, is important as well in a different way, but we can cover that on another video. So to dig into this concept of centralized pain, a good way to describe it is like our body's nervous system is like a house alarm. So the house alarm is programmed to prevent people from entering your home, taking or damaging property. Similarly, our body uses nociceptive pain to indicate that the activity we are performing is damaging our tissues and to notify us to stop that activity. But this alarm system that our body has can become too sensitive. In this case, small movements that are not damaging to our body become painful. It's similar to a house alarm that's too sensitive and goes off when leaves fall on the ground or a squirrel runs across the lawn. So it's basically saying that, our body has a threshold where that alarm's going to go off. And if we don't have this long-term pain, we have this big gap of things that are all safe to do, that our brain and body feels is safe to do without setting off the alarm. And if we have pain for a long enough time, that gap shrinks so that all these minimal activities or this minimal amount of activities is what is safe, and then just anything beyond that causes the alarm to go off and us to have pain. That's that concept of centralized pain. So the biggest takeaway here is the 5 tips for success. So number 1, to help decrease your pain, just knowing about it, knowing about this concept, knowing about the difference between nociceptive pain and centralized pain helps your pain in general. There's been research studies done that if we just teach people and we ask their pain before and after, their pain complaints get better after, just knowing. No exercise, no fancy treatment, nothing else. Number 2, get a good night's rest. So not sleeping well greatly delays our body's healing process. Putting away electronic devices, turning off the TV an hour before bed, performing 20 minutes of exercise a day are great ways to improve our sleep quality. So there's a few strategies, but sleep quality and duration is very important because that's when our body does all kinds of funky things to heal itself and recover for the next day of activity. Number 3, decrease your stress. Not a lot of people think about this, but how important it is. Our mind and our body are strongly connected. When we are under high stress, pain becomes triggered quickly and more frequently. It thus makes that alarm system more sensitive. I was just talking about that with a patient a few minutes ago in clinic. Like, we can clearly, all of us as clinicians can see the stress level that this person's on, but they don't even realize that stress could be a contributing factor to their back pain. Number 4, do not talk about your pain with your friends or family. Now, this sounds like a counterintuitive one. Obviously, when you come into therapy, we need to know what things are working and are not working, so you need to tell us. But beyond that, you don't need to tell anybody else, because through talking about pain, it keeps pain in the forefront of our minds. And this makes our that alarm system more heightened to pain. All right, number 5 is my favorite, exercise. So there's a saying in this pain science realm that motion is lotion. So as mentioned above, exercising can help decrease stress and increase sleep quality. Additionally, exercise helps teach our nervous system that we are safe to move. And it helps us make this alarm system less sensitive. So exercise is the fountain of youth. You'll hear me say it till I'm blue in the face. I've experienced it in my life. So I'm not just talking about theory here. I think that if you continually adopt that idea of exercise, it's going to help your body in so many ways that is very profound. So there you have it, guys. That's our pain talk that we give with everybody that walks through our doors. And I hope it helps you watching this video at home. Take care.